tuned in to the Andrew Lawton Show.
Let's talk about another issue where certainly the legal issues have not been solved by the court, so we perhaps have to look for political solutions. And healthcare is a tremendous example of that. Healthcare choice. It's not really something we have universally available to Canadians. If you are in Quebec, you have that option because the Supreme Court has decided you do, but only in Quebec, not if you live in another province, certainly not in British Columbia. We view healthcare, rightfully so, as a provincial issue, but there was a piece from Colin Craig, who's the president of secondstreet.org, that says we need to put some of the blame on federal gatekeepers as well. He says we should demand healthcare choice from federal political leaders. Colin Craig joins me now. Always good to talk to you, Colin. So, let's just explain the basics here. Why is this an issue that is federal?
Well, it's a reality that the federal government gives provincial governments billions of dollars every single year for healthcare. It is a minority position. So when you go to a hospital and you get care or you visit your family doctor, the bulk of the bill is paid for by the provincial government using tax dollars. But Ottawa, they still receive a decent portion. I don't know the exact percentage offhand, but they still receive a decent enough portion that they certainly want to keep Ottawa happy because they don't want to lose those dollars. And so sometimes when provincial governments go to do things that Ottawa doesn't like, they threaten or they actually come in with funding cuts in terms of how much they're giving for healthcare. So that's how Ottawa is tied into this. And it's done through the Canada Health Act, which is basically a funding mechanism in terms of how Ottawa agrees to give provincial governments money for healthcare.
So one of the things that I find just so baffling here, and again, we just had Marty Moore on to do the legal stuff, so you and I don't have to go down the legal road, but the Supreme Court has said, access to a wait list is not access to healthcare. They've said that you should have the right, if you have the means available, to go and do something else. They've just said this is the case only in one province alone. It would arguably be more of an easy pill to swallow if they had said no across the board. But in this case, someone in British Columbia can't go to the Cambie Clinic, but someone in Quebec can go wherever they want to go.
Yeah, and just make a distinction for your listeners, because this can get a bit confusing sometimes. And what people don't always pick up on is that it's getting private or non-government care locally. This is the sticking point. As a Calgarian, if I need a hip operation, I cannot pay in Calgary or anywhere else in Alberta. I can fly to British Columbia and pay to get one there. I can fly to certainly Quebec and other provinces. So you actually have the same problem in BC. Someone in Vancouver cannot pay at a private clinic in Vancouver. They can in Calgary. So you see this happening where people...
And it's the same doctors that could have just served the person in their own province if legal.
Yeah, it's crazy. No other country on the planet does what Canada does in this regard. It makes no sense in terms of cost. You're increasing costs for patients. You're inconveniencing them at a time that usually this is the last thing they need. If you've got chronic pain because you're waiting for a hip operation, like last thing you want to do is jump on an airplane and go somewhere else to get it done. So it makes no sense at all. If you're the federal government, I would point out it's bad for the environment, right? To force people to have to travel even further to get the care they need. But I certainly wouldn't criticize any patient for doing what they can to improve the health of their bodies.
So when you talk about this in level-headed terms, I think, wow, this is easy. Why isn't every Canadian getting on board with this? But you bring it into the public realm. Certainly, if a politician were to ever say what you're saying in as dispassionate and mild-mannered a way, they're going to have the activists jumping, saying they're privatizing healthcare, American healthcare. You're going to be no longer served if you don't have money. People are going to go broke. Like, you have all of these doom and gloom scenarios, which... How do you push back against that? I mean, how do you tell people that actually, no, it increases care for everyone?
Yeah, so, I mean, that's really the debate that dominated 20, 30 years ago. And this is why we didn't see any changes back then. The public has shifted. And credit to groups that were around before us, and certainly we've been talking about it for several years now. But the reality is there's not two systems on the planet. It's not just Canada or the US. There are lots of countries that have universal systems like Canada, Norway, Sweden, France, throughout the European Union, Australia, New Zealand. And, many reports show that they're doing better than Canada. And the key difference is that they give patients the choice between using their public systems or using non-government options, whether it's a nonprofit clinic, a private clinic, whatever. Patients have that choice. We don't typically have that choice, as we've just discussed in Canada. So I think more and more Canadians understand that. They're on board with it. The polls show that a large majority of Canadians understand that throwing money at the system is not the solution. We spend a lot of money on healthcare in this country. That's not the problem. The problem is that we don't get good results because of the structure of the system. And giving patients choice, it helps take pressure off of the public system. My bet is if we did that across the country, made it easier, the vast majority of people would still use the public system, and that's fine. But you'd probably have maybe around 10-15% that would use non-government options. I mean, that's kind of been the Swedish experience. And who wouldn't want to take 10 or 15% of pressure off of our healthcare system right now? It would be, a significant benefit. And combined with other reforms, we could ultimately deliver better care for patients.
But the response you get to that is what happens if 10% or 15% of the doctors decide to leave the public system and go to the private system? Then you've not really helped anything. And what's the answer to that?
Yeah, I'm glad you raised that, because a lot of people raise that point. And what I always respond with is, well, how does Sweden do it? How does Norway do it? How does Australia do it? I mean, all these other countries that perform better than Canada, they have found a way to do it. And often the solution is that they will cap, in the United Kingdom, for example, they cap how much time someone in the public system can work in the private system. The second thing to keep in mind is that when you have more employers, you end up with more employees. This is something that the Swedes told us when we were in their country last year talking with people about healthcare. And I thought this is a great way of explaining it. Because when you have a more vibrant healthcare sector, you have more choices for people in the healthcare sector in terms of where they want to work. Right now in Canada, you often have doctors and nurses graduating, and they look around, and often the option is, well, I work in the government system or I go somewhere else. Well, if they had more choices in Canada, then we could retain more doctors, we could retain more nurses, we wouldn't have the shortages that we have right now.
And I know it's not perfectly analogous, but I would also say that we could look at the education system. It's another regulated professional designation to be a teacher. We have private schools. We have not seen this mass exodus of public school teachers to private schools, because we also forget that people are motivated by different things. People that go into healthcare are motivated by different things. You may really want to be in a hospital and a family medicine practice, and you'll stay in the system because it offers you something.
Yeah, I mean, I love that example. We've used it too, Andrew, because it's such a good comparison. Across Canada, we have choices for parents. You can put your kids in the government-run system, or you can pay for a private school, independent school, whatever. And the vast majority of Canadians still choose the public system, and that's totally fine. But when some parents decide on private options, again, they're taking pressure off of those public school systems. The point about choice for workers is important. Here's a crazy number that we were able to calculate using some data from the state of Michigan, is that there's nearly 2,000 nurses who live in Ontario and get up each day for work, and they cross the border into Michigan, primarily working in the Detroit area. Like that is huge. And we talked to them, we surveyed them, we said, well, why are you doing this? And the number one reason, it actually wasn't compensation. It was the availability of work. They had the types of work, like positions that they wanted. But the second reason was compensation. And right behind it was working conditions. And many of them noted that they could get these jobs in Michigan. They were the way that they wanted them. They were full-time, came with benefits. They came with a predictable schedule. I mean, you had a competitive environment in Michigan where they were having employers competing to attract these workers and finding ways to give them the type of work arrangements that they wanted. Whereas in Ontario, they were looking at it and they're looking at the government system and saying, no, I just don't want to work there. And this has been a problem for a long time. You can't blame the current government, can't blame even, I don't think, the former government, because it's the problem when you have this monopolistic environment.
To be honest, I wonder why. I should I understand why. But if you really think about it, it's quite surprising provinces haven't seen the opportunity in this. Because if you're a provincial government and you can come up with a pitch that you can make to voters, which is you will not pay more in taxes, you will not have any reduction in your care, but you will have this added option. And at the very least, even if you can't afford to use it, there will be fewer people on the wait list ahead of you in the public system to get it because, 2 or 3 of those folks will go to the system. You've actually eased the healthcare crisis without having to spend a dollar. And I really don't know why provincial governments have not been the ones to take the lead and call for that.
They're concerned about funding cutbacks from Ottawa.
But to bring the fight to Ottawa, let us do it. I mean, we see provinces on drug decriminalization saying, not as much anymore, but saying, hey, give us the right to do this. They could do the same thing provincially if they wanted to expend the political capital doing so.
They could. I think it would be wise for patients for them to do this. And the easiest, I think, argument they can make going into Ottawa is, look, Ottawa, you're allowing Quebec to do this. Quebecers get more healthcare rights than anyone else in the country. We need to even the playing field and give all Canadians the same rights that Quebecers have. I think that's the argument that needs to be made if you're in BC, Alberta, wherever. I mean, the BC government obviously isn't going to make that argument, but certainly others could. In Ontario, Doug Ford could stand up and make that argument. We don't really look at this through a partisan lens, but the bottom line is it would help patients. And it makes sense for elected officials to do it. The public is behind them. This is, like I say, this isn't the debate from 20 years ago. The public has heard, they've seen governments do the same tired old approach of throwing money at the system, hoping something's going to work. It hasn't worked. It's failed. It's time to start looking at what these countries that perform better than Canada, what they do. And then we can start copying them and bring our standards up. And this is one thing among several changes that could be made to improve results for patients.
Colin Craig, always good to talk to you from secondstreet.org. Thanks so much for coming on today.
Thanks for having me, Andrew.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.